Next, it is my honor to present Patercia Tarrago, the Bureau Chief of the Bureau of Women's and Children's Health at the Arizona Department of Health Services.
Good morning, everyone, and welcome to this amazing conference. I'm really excited to be here with you all today. Thank you, Dr. Hellitzer, for your welcome and comments. And also just a special thanks to Dr. Brenning for Meg for including me in this opportunity to join you all here today. I also want to thank the Arizona State University College of Health Innovations for creating the space for this year's conference on maternal and child health populations. I'm so pleased to see the number of participants at this event. While we are at a virtual event, it is clear that we have so many individuals that are committed to addressing and improving maternal and child health in Arizona. So just to share a little bit about myself, I was born and raised in rural Pinal County in a tiny unincorporated farming community of Stanfield, Arizona. I'm a teen mom many years ago, and I know firsthand how important it is, the resources that are made available through maternal and child health programs in Arizona. So I want to thank you all for the work you did back in the late 70s and 80s, helping me support myself and my son in moving more along with our personal goals and growth. I also want to share with you that I'm a proud Sun Devil and an Arizona State University alumni. I obtained my bachelor's degree in social work from Arizona State University. So it's a real honor for me to be here with you all today. I have a master's in health administration from the University of St. Francis. Being the Title V Maternal and Child Health Director for the state of Arizona is certainly a gem and a milestone in my career, and I'm grateful to be a part of this body of work. A little later this morning, I will share some details related to the work we do at the Arizona Department of Health Services Bureau of Women and Children's Health and the role the Bureau plays as the Title V Maternal and Child Health Office here in Arizona. While some of our responsibilities are outlined in the Title V Maternal and Child Health Block Grant, such as the 5-year statewide needs assessment that you'll hear a little bit about today, some responsibilities are state legislative mandates, such as the annual child fatality review reports, maternal mortality review activities, and the Arizona Medically Underserved Area Report, just to name a few. One of the beauties and flexibilities of the Title V Maternal and Child Health Block Grant is that the grant lends itself to address emerging issues and respond to the needs of local communities and populations. Reflecting on the conference theme of resiliency in maternal and child health populations, I want to highlight just one example of the impact the Title V Maternal and Child Health Block Grant has had, and that is the development of the Governor's Gold Council Breakthrough Project on Maternal Health. With a lens on health disparities among American Indian women in Arizona, using data to inform our work and pulling the expertise of the Maternal and Child Health Assessment and Evaluation Team at Arizona Department of Health Services, our Bureau, in partnership with the Arizona Perinatal Trust and the March of Dimes of Arizona, brought together a group of stakeholders that established a statewide maternal health task force that includes tribal representation. Hearing from our tribal stakeholders and based on their input and unique needs, we also established the Tribal Maternal Health Task Force. These two groups work jointly to provide input on the development of a 5-year Governor's Gold Council Breakthrough Strategic Plan to improve maternal health, specifically looking at decreasing maternal mortality and morbidity in Arizona. While this is a While this is a statewide strategic plan, reviewing Arizona-specific data that indicates a significantly higher burden of mortality and morbidity among American Indian women, special attention is given to the needs of tribal communities, beliefs, traditions, culture, and practices as we implement this plan. Leveraging this work supported by the Title V Maternal and Child Health Block Grant, we utilize this plan to seek additional funding to further expand our maternal health efforts. Our hard work paid off. In the summer of 2019, our Bureau received 2 grants. One is a 5-year, $500,000 annual grant from the Center for Disease Control and Prevention to establish the infrastructure, data collection, analysis for the Maternal Mortality Review Program and the Maternal Mortality Review Committee, and to disseminate the recommendations that support improved outcomes for pregnant and postpartum women. The second grant is a 5-year grant from the Health and Human Services Resource Center, the Maternal Health Innovation Grant. I'm proud to share that Arizona is one of 9 states nationwide to have received this competitive grant with an annual award of $2.2 million. This grant supports and assists in the execution of the 5-year Governor's Gold Council Breakthrough Strategic Plan on Maternal Health. This plan addresses health disparities, utilizes evidence-based strategies, and inclusivity of women, family members with lived experience to have a voice and be at the table with us. It improves access to prenatal care through the use of telehealth and telemedicine. It provides training, for example, on implicit bias for clinicians and other workforce members that work with pregnant and postpartum women, and supports systems of care through the use of maternity safety bundles while enhancing data collection, all with the goal to improve health outcomes for maternal care in Arizona. Needless to say, we are excited about this work. While this is an example of a robust plan, the unforeseen challenges that society has experienced due to COVID-19 pandemic have required each of us to do our work differently in order to continue to meet the needs of women, children, and families in Arizona. Like each of us, families have and continue to experience significantly higher levels of stress from no childcare, virtual learning for school-aged children, virtual work settings for those of us that are fortunate to continue to be able to work. Some families have had job and income loss. Food insecurity has escalated. Evictions, along with the tragic loss of life from COVID-19, are just a few memories and realities that our families are facing. Social injustice that has led to social unrest and protests across the country in the middle of a pandemic. These images will stay with us forever. And yet, the social injustice actually galvanized communities in a way that had not been seen in decades. Yet when it seems like we have seen so much across our country, this week we see a video of an abandoned, lost, hungry, and frightened 10-year-old boy near the border asking for help. This image reminds us all of the work that we have ahead of us to continue to protect children, provide safety and basic needs, along with resources to strengthen coping and resiliency skills. This pandemic has shed a huge spotlight on health disparities, the tremendous need to create change and address systemic policies that impact social determinants of health. While 2020 was riddled with challenges, last year also created an opportunity for us to reevaluate priorities and approaches in programs, practice, and policy, as well as our own priorities personally. The need to explore new prospects to support and enhance coping skills and build resilience among families, communities, and ourselves has never been greater. The agenda for this conference creates a path for each of us to reignite our passions, as we continue on our journey of learning, service, and commitment to women, children, and families in Arizona. So please enjoy the conference, and thank you so much for allowing me to share these remarks with you this morning.
Thank you so much, Patricia. Really apropos kickoff for our meeting. Very poignant comments.